Welcome back to Hypertension Resistant to Treatment, the podcast where we break down complex heart health topics into simple, everyday language you can use. I'm your host, Dr. Tanya, and today we're tackling a big one, these 10 mistakes that make your blood pressure look too high. Now, if you've ever checked your blood pressure at home or in the doctor's office and thought, wow, that can't be right, you might be correct. Sometimes the number is high, not because of your health, but because of simple measurement mistakes. So let's walk through the 10 most common mistakes people make when checking blood pressure and what you can do instead. 1. Talking during the measurement. It might feel awkward to sit in silence, but chatting, even just saying hello, can raise your reading. Stay still and quiet during the test. 2. Crossing your legs. Sitting with legs crossed can actually raise your systolic pressure by up to 10 points. Keep both feet flat on the ground. 3. Poor back support. If your back isn't supported, your muscles tense up, and that tension can bump up your reading. Sit comfortably in a chair with your back against the backrest. 4. Wrong arm position. Your arm should be at heart level. If it's too high or too low, the reading won't be accurate. Rested on a table or armrest. 5. Using the wrong cuff size, too small. Your reading looks higher than it really is. Too large, it may look lower. Make sure you're using the right size cuff for your arm. 6. Clothing in the way. Don't roll up a tight sleeve or measure over a shirt. That creates pressure and can raise the reading. Place the cuff directly on bare skin. 7. Not resting beforehand, rushing in from activity, climbing stairs, or even being stressed can spike your numbers. Rest quietly for at least 5 minutes before measuring. 8. Taking just one. Reading blood pressure can fluctuate. Take 2 or 3 readings a minute apart, then average them. That's the number your doctor wants to see. 9. Measuring after coffee, smoking, or exercise. Nicotine, caffeine, and activity all temporarily raise your blood pressure. Wait at least 30 minutes before checking. 10. Not emptying your bladder. Believe it or not, a full bladder can raise systolic pressure by 10 to 15 points. Go before you measure. And there you have it. 10 simple mistakes that can make your blood pressure look too high. If you're living with resistant hypertension, meaning your blood pressure stays high even when you're on multiple medications, getting an accurate reading is more important than ever. A wrong measurement could lead to unnecessary medication changes or missed warning signs. So next time you check your blood pressure, set yourself up for success, sit comfortably, rest beforehand, and follow these tips to get the truest picture of your numbers. Thanks for joining me on today's episode of Hypertension Resistant to Treatment. Don't forget to subscribe and share this episode with someone you care about.